Hi, my name is Jessica Dixon. I'm a nursing student here at South Alabama, and today I'm going to be performing the IV checkoff. So the first thing I would do is I would verify the order in the hospital policy. And after doing that, I would gather my equipment and then I would perform hand hygiene. So next, I would verify my patient using two identifiers. So Jaguar J. Jones, date of birth 8/25/1963, 8/25/1963. So it says he's allergic to penicillin, and penicillin is on here as well. I would want to ask my patient if he was allergic to anything else that wasn't listed, and I would want to explain the procedure to the patient and provide them with privacy. So the next thing I would do is I would perform, position the trash can, perform hand hygiene, and now I want to don my goggles. So now I would want to raise the bed to a working height, lower the side rail, position my patient comfortably. I would put them either supine or sitting position, and I would do this while maintaining privacy. So next I want to open my sterile packages. So this would be on the bedside table and it will be at waist level. So I want to open and arrange my equipment. I did forget to get an alcohol swab, but I will want to now clean the injection cap. So once that is done, I'm going to want to prime the tubing. So I'm going to make sure that it comes out. Okay. And then I'm going to connect this and to prime, make sure that we see it coming through the tube. And there it goes, it took a little bit. Okay, so now that it's primed, I'm going to loosen the cap. And I'm going to place it in the sterile container. So next thing I want to do is I want to open up my over the needle catheter from the wrapper and my transparent dressing. And now I want to give three principles for selecting a vein. So one is going to be choosing the most distal site. Two is going to be doing the non-dominant arm if able. And three is going to be avoiding areas of pain, infection, or wound. So the three principles for fostering venous distension would be one, stroking the veins lightly. Two would be have the patient open and close their fist slowly if able. And three would be making sure that the extremity was in a dependent position. So the next thing I want to do is I would want to apply the tourniquet 4 to 6 inches above the insertion site. So once that is done, I'm going to assess the vein for appropriateness. I'm going to check the radial pulse. And once I do that, I'm going to want to apply my clean gloves. And then I want to move my saline lock closer, maintaining sterility of the package. So the next thing I want to do is I would want to clean with chlorhexidine. So I would squeeze this to activate, and then I'm going to clean the site using friction, going horizontal, vertical, and circular for 30 seconds. So once I get that clean, I'm going to dispose of that. I'm going to wait for it to completely dry. This time I would not touch the site because it is now clean. So the next thing I'm going to do is I would want to, after it's completely dry, it would be time for me to do the venipuncture. So I'm going to remove this. I'm going to anchor the vein 1.5 to 2 inches below the insertion site, and I'm going to pull it back in the opposite direction of the insertion site. So I'm going to do that. I'm going to pull it back. So also I'm going to want to instruct my patient to remain still and that there will be a quick poke. So now before insertion, I want to make sure that the bevel is up. Once the bevel is up, I'm going to insert at a 10 to 30 degree angle, making sure that I avoid touching my gloved hand to the catheter. So once I get it in there, I see blood return. I'm going to lower it, and then I'm going to insert 1/4 of an inch more. Once I do that, I'm going to grab the catheter. I'm going to push it forward all the way to the hub. Once I get it all the way to the hub, I'm going to make sure that I only move that, not the needle. Once I get it all the way to the hub, I'm going to pull the tourniquet immediately. So then I'm going to apply pressure 1 1/4 inch above the insertion site. So once I do that, I'm going to remove the needle. I'm going to quickly get this while maintaining sterility. I'm going to open it up and connect it quickly. So once it is connected, I'm going to try not to move it around so much, but I'm going to temporarily secure with tape. So now that it is secured with tape, I would want to assess for blood return again. So I would actually aspirate back, and I would make sure that blood came through the tubing right here. And then I would want to flush the rest of the saline into the vein. I would be looking for swelling while I did this. Whenever all of the fluid has went in, I would remove this and dispose of that in a sharps container. So the next thing I want to do is I want to apply the sterile dressing, or the transparent dressing. So I'm going to open this up. I'm going to avoid touching it under. So I'm going to put this from all the way up to the hub. So then once that is on there, I'm going to want to remove the trimming. Okay, I'm going to keep this for labeling. So now I'm going to allow my tubing to assume my natural position so I can secure it with tape. So then I will secure the tape. Once that's done, I'm going to remove the temporary tape. Okay, so once that is done, I'm now going to gather my equipment and dispose of it. This I'm going to be using for another part of the procedure, is the sterile gauze. And now I'm going to remove my gloves. So the next thing I would do is I would prepare the label. So I'm going to put the date, the time, my initials, and the gauge size, which is 22. So I would remove this. And place this on the edge of the transparent dressing. And also, when I inserted the needle earlier, I just wanted to make sure that I was doing it parallel to the vein. So the next thing I'm going to do is I'm going to lower the bed, raise the side rails. I'm going to position the patient comfortably and safely, and then I'm going to explain to the patient, ways to prevent dislodging, as well as signs and symptoms of IV complications. So this would be things such as infiltration, inflammation, or phlebitis. I would also instruct my patient to let me know if there was any fluids slowed or if they stopped, as well as if there was any blood coming in through the tubing or under the dressing. I would also want to let my patient know that that they need to prevent it from moving, so protect it when they're moving, as well as the importance of wrapping it before getting in the shower. So now I'm going to perform hand hygiene, and then I'm going to do documentation. So for documentation, I would need to document the date, the time, the location, the catheter gauge and length, as well as how the patient handled the procedure. I would also need to do the number of attempts, as well as the presence of the saline lock, and also the or flow rate, and as well as the method of infusion if fluids were prescribed. So the next thing I'm going to do is I would discontinue the catheter. So what I would want to do is I would want to make sure I had gloves on. I would want to put on gloves. So now what I would want to do is I would want to make sure that I stabilize the catheter. Now I'm going to remove the dressing. I'm going to do this towards the center of the injection site. If I can get it up. There we go. So I'm going to be pulling towards the center of the injection site while I'm removing. Okay, and once I get that done, I'm going to dispose of that. And then I'm going to want to get a sterile gauze. So this would be on a bedside table, and it would be sterile. So now I'd want to put this over the injection site. So now I want to remove the tape. Alright, and to pull this out, I would need to use my dominant hand, and I would need to keep it parallel to the vein and remove slowly. Once it is out, I'm going to inspect the catheter for intactness, and then I'm going to dispose of that. So the next thing that I would do, that's supposed to fall in there. So the next thing I would do is I would hold pressure for at least 30 seconds, and just to stop the bleeding. And I would be needed to be observing the site for pain, tenderness, or redness, as well as swelling, drainage, or bleeding. So once that is done, I'm going to have a clean, sterile gauze, and then I'm going to tape it on there. And this completes my check-off.